त्रिलोक्यनाथाय विष्णवे नमः।
सभी को मेरा नमस्कार। विश्व आयुर्वेद परिषद की ओर से आयोजित इस अनवरत व्याख्यान माला में मैं आप सभी का हार्दिक स्वागत करती हूँ। आज एक नए उत्साह के साथ, नई ऊर्जा के साथ, नए स्पीकर के साथ, नए विषय के साथ हम आपके सामने उपस्थित है और हमारा उद्देश्य है कि हम भारत में बहुत सारे श्रेष्ठ चिकित्सक निर्माण कर सके, जिनके माध्यम से जब कभी भी ये अच्छा दिन आयुर्वेद का आए कि आयुर्वेद भारत की राष्ट्रीय चिकित्सा पद्धति घोषित हो, तो हम भारत के अनेक लोगों तक हम आयुर्वेद को बहुत ही सरल तरीके से पहुंचा सके, उसको समझा सके, भारत के लोगों की चॉइस में आयुर्वेद आ सके। तो डॉक्टर साहब, बहुत बहुत हार्दिक स्वागत है आज के व्याख्यान के लिए। और इससे पूर्व भी हमने आपका 517वां व्याख्यान किया और बहुत अच्छा एक्स्ट्रा ऑर्डिनरी रहा और वो इमरजेंसी व्याख्यान था। आज मैं फिर से आपको, क्योंकि ये हमारा पहले से ही डिसाइडेड व्याख्यान दिनांक थी, तो उसको भी हम आज सभी के सामने करेंगे प्रेषित। और सबसे पहले मैं आपका परिचय सबके सामने रखना चाहूंगी। वर्तमान समय में आप प्रोफेसर एंड हेड ऑफ द डिपार्टमेंट पद पर कार्य कर रही है। RRAMCH एंड पीजी सेंटर, हुमानाबाद डिस्ट्रिक्ट बीदर, कर्नाटक में अभी वर्तमान समय में आप काम कर रही है। और प्रत्येक उसमें जो नए बच्चे भी जुड़ते हैं तो उनके लिए भी मैं एक बार आपका सीवी सबके सामने संक्षिप्त परिचय रखना चाहूंगी। आप रोग एवं विकृति विज्ञान, रोग निदान एवं विकृति विज्ञान डिपार्टमेंट में काम करती है। इससे पहले जहां आप वल्लभ विद्यानगर आनंद गुजरात में GJPI ASR वल्लभ विद्यानगर में आपने काम किया, जहां आपने बहुत सारी भूमिकाओं में काम किया, जिसमें नेक कोऑर्डिनेटर IQAC है ना, क्वालिटी वाला एक बहुत अच्छे सारे वो रहते हैं, वो भी आपका हमने देखा कि एक्स्ट्रा ऑर्डिनरी उसमें 19 इयर्स का यूजी का एक्सपीरियंस, 2 इयर्स का पीजी का एक्सपीरियंस, उसके साथ साथ आप पैनल ऑफ द पीएचडी एग्जामिनेशन में भी है। NABH का जो मैंने बताया इम्प्लीमेंटेशन ऑफिसर के रूप में भी आपने भूतपूर्व कॉलेजेस में काम किया। प्रेजेंटली ऑल्सो वर्किंग एज ए IQAC कोऑर्डिनेटर। You have completed 3 research projects and clinical experience में you are able to manage ICCU and NICU also। पैथोलॉजी लेबोरेटरी के आप हेड के रूप में अपनी भूमिकाएं निभाई। डिलीशियस कुकिंग फॉर द ग्रेट हेल्थ फ्रॉम अर्पित प्रकाशन, नागपुर से आपकी बुक प्रकाशित है। इसके साथ साथ आपने अर्श यानी पाइल्स इन द व्यू ऑफ आयुर्वेदा एंड मॉडर्न चौखम्बा ओरिएंटलिया से प्रकाशित है पुस्तक आपकी। और संक्षिप्त श्रीपद श्रीवल्लभ चरित्रामृत, ये कंसाइज बायोग्राफी लॉर्ड दत्तात्रेय जी के ऊपर है, वो भी आपकी रुद्र प्रकाशन के माध्यम से प्रकाशित है। एक्स्ट्रा करिकुलर एक्टिविटीज में यू हैव डिलीवर्ड सो मेनी गेस्ट लेक्चर्स एट द वेरियस प्लेटफॉर्म एंड peer reviewed आर्टिकल्स, नेशनल एंड इंटरनेशनल जर्नल्स में भी आपका बहुत अच्छा योगदान रहा है। और पेपर प्रेजेंटेशन एंड पोस्टर प्रेजेंटेशन भी दोनों तरीके से, नेशनल इंटरनेशनल तरीके से आपका अच्छा उसमें कर्तृत्व है। एस्ट्रोलॉजी एंड आयुर्वेदा, इसके ऊपर भी आप अच्छी ज्ञाता है, उसके ऊपर आपने आर्टिकल्स भी लिखे हुए हैं। और जैसे मैंने पहले भी बताया कि यू हैव वॉन सो मैनी प्राइजेस एट द डिफरेंट लेवल। जो हम आयुर्वेद के चिकित्सक हैं उसमें कुकिंग कंपटीशन इन केरला, उसमें आपने फर्स्ट प्राइज को जीता था। तो ऐसे विद्वान बहुत सारे और भी प्राइज है, मगर मैं बहुत शॉर्ट में बता रही हूँ। बहुत सारे टीवी टॉक्स में आपने डिलीवर किए हैं। एज अ चीफ पर्सन आपने बहुत सारी जगह पे उसमें पार्टिसिपेट किया है। तो और गवर्नर के हाथ से भी आपको बेस्ट अवार्ड मिले हैं। तो ऐसे विद्वान स्पीकर का मैं इस प्लेटफॉर्म पर पुनः स्वागत करती हूँ और आज के व्याख्यान के लिए आमंत्रित करती हूँ। ओवर टू यू डॉक्टर साहब, नमस्कार, वेलकम जी।
हाँ मैडम, स्क्रीन मूव हो रही है?
नहीं, पहले वो
स्क्रीन विजिबल है?
मिरर, हाँ मिरर व्यू हो गया था, अभी तो प्रेजेंटेशन नहीं दिख रही डॉक्टर
हाँ
साहब।
हाँ, ओके, मैं ट्राई करती हूँ, क्या
जी
प्रॉब्लम है तो। हाँ,
जी डॉक्टर साहब, आप शुरू कर दीजिए।
ओके।
ओके, विजिबल।
यस यस
ओके
यस।
ओके, स्टार्ट करिए डॉक्टर साहब, है ना। मैं क्षमा प्रार्थी हूँ, थोड़ा सा दिक्कत हो गई है ना,
या
तो शुरू करते हैं डॉक्टर साहब। वेलकम अगेन एंड स्टार्ट।
Good evening, everyone, and sorry for the inconvenience. There was some technical errors, but from my side, I am humbly request you to forgive me for this. So today's our topic is Hridroga or the cardiovascular diseases. I'm going to explain about the similarity as well as the slight differences in between the modern cardiovascular disorders and the context explained Hridaya Roga. There is a madam next screen. Yeah. So in this regard, we know that today's era is going to the many type of the symptoms, like the small kids. Even the small kids are suffering from the cardiovascular diseases, and the reason behind that, this is our lifestyle, our uh, bringing up of the kids, or our psychological effect, everything are there which are making us more susceptible for the cardiovascular diseases in this era. So considering all this fact, this was very detailed explained in the Ayurveda since years together, means thousands, more than 1,000 years together. That's why we have to more focus what are the reasons explained in the uh, contextual area and nowadays also. Next, madam. So if we consider this as a coronary cardiac
जी
disease,
बताइए।
this is a lifestyle disorder, and that's why it is causing the
ठीक है बेटा।
premature death in the developed countries. Not only the developed countries, even the countries like in the India, this is also increasing. For example, if I would like to give
जय श्री कृष्ण।
in the India, almost 280 per lakh deaths are occurring every year from the coronary vascular diseases, and in the other countries it is the number is 233. Means definitely we can say that the coronary heart disease is quite common and more prevailing in the in India also. Next, madam. Next. So if we consider all these things, we have to uh, give the more focus on the prevention as well as the treatment of the cardiovascular disease in the India. The thing is that we are not going to handle much more disease by the treatment, but the Ayurveda can contribute here with the preventive aspect as well as the we can handle this disease in the aspect of the their management or the co-management. That's why we have to focus on the cardiology explained in the Ayurveda, because many of the things are ashukari. Coming under the ashukari means the diseases are very instant, they are rapidly growing, the symptoms are very progressive, and it needs the immediate attention and the fast acting medicine. So in such a situation, what will be the Ayurveda's contribution? It is a big part, and then we have to consider for the contribution in the part of either diet management, their mental status management, and the other co-management of the diseases. Okay, so if we consider this Hrudaya, that is a Ayurveda has given more context for the Hrudaya, as this Hrudaya is the prana of the pranapana or the dashadhamani. Means this is about the sthana of the rasavais, the mula sthana of the rasavastrotas as well as pranavastrotas. So whenever you consider that there is a problem of the circulatory system, it contributed simultaneously the infection or the problem to the pranavastrotas. Or we can say that the vice versa. So pranavastrotas, it is the moolasthana of pranavastrotas as well as the rasavastrotas. So if pranavastrotas get affected, there is the chances to get the hrudaya vikruti as well as rasavastrotas vikruti. We can see there is a chances of getting the diseases of the heart. You can see that in the era of the COVID-19, you have seen that many of the patients of the having the COVID infection, they are having the problem, or those who are having the comorbidity of the hypertension, diabetes, they are more prone for the death at that time, because we can say that this is just related to the Moolasthana Vikruti. And Hrudaya is the Moolasthana of the Pranavastrotas as well as the Rasavastrotas. So it can be considered as a main Chetana sthan, means which gives the alertness, consciousness, and all this. So we will move to the major first part of the Hrudaya Roga. So what is a Hrudaya Roga? Hrudaya Roga is nothing but the diseases causing to the Hrudaya itself, or the symptoms which are developed because of the ill health of the Hrudaya, they all are together called as the Hrudaya Roga. Means Hrudayasya Rogam Hrudrogam, or the Hrudivada Prachakshate Hrudrogam. So the thing which causes the pain or the variety of the diseases to the heart, that all we are considerably considering as the Hrudaya Roga. So the small symptom related to the Hrudaya Roga, that can be also we are counting, means a symptom which is contributing in a major part, that also we are considering under the Hrudroga. Next. So there are many causes explained for the Hrudaya Roga, and if we consider this era with the old era, so the symptoms, the causes explained in the context and the present era situation are very, very similar. Though the Ayurveda has stated that Atyushna Gurvarna Kashaya Tikta Shramabhigata Adhyashana Prasangaihi Sachintanam Vega Vidaranascha Hrudayamaha Panchavida Pradishta. So these are the very, very specific reasons explained by the Acharya, as well as Vyayama Tikshnata Vireka Basti Chinta Bhaya Gadaticharaha Urdhvam Asandaranam Karshanani Rudroga Karturi Tathabhighata. So if we consider this both two reference explained in the text of the Charik Chikitsastan as well as the Madhav Nidan, we can find out altogether that these reasons are related to the more lifestyle. Some of them are Aharajanya, some of them are the Viharajanya, and some of them are the Manasika reason. So if we try to control all these things, it can give the good reasons. So if it is a Aharajanya, what it will make? This Ahara, Guru Ahara will make the Amut Pinti in the Sharira. So how this is going to make the Ahara? Nowadays, you can see that day they are talking about the Snigdha Madhura Ahar in the form of the Payas, Kuda, Sharkara, and Kapavardaka Ahara. But nowadays, we can say that this is change in the with the pizza, burgers, which are having the more cheesy material, or eating Adhyashana means frequent eating. So now we have changed the habit. Abhi thoda khayenge, fir thode der se khayenge, fir thode der se khayenge. And Tikshnahar, eating the very spicy, sitting in the this AC and eating the so Viruddhahar. So like this, it will vitiate the kapha as well as pitta, then causing the stress, strain, which causes the Vata Prakopa, Bhaya, Chinta, Gadaticharam, all are increasing the Vata. So ultimately, we can find out that this is vitiating the Vata, Pitta, and the Kapha. Means three doshas are vitiated very typically with this ahara, vihara, and the other hetus. Manasika hetu are very predominantly, and they are responsible vitiating the this vayu, because you can see that the emotional factor is very important in the handling of the Rudroga. You can see that there is a very close relation between the Rasava Srota Dushti Vikruti and the Manova Srota Dushti Vikruti. You can find out the one word that Rasavahini Dushanti Chintana Mati Chintana. Means we can say that the A-type personality people, like highly responsibility given people, or the stress managers, or the person who are always having the fear or the stress, irritability, they will have the frequent Vata Pitta Prakopa in the Sharira, ultimately causing the Vyanavayu Vikruti, which is nothing but the causing complication in the circulatory system. So these are causing the Tridosha Dushti, and ultimately responsible to make the two main culprit. First, it will cause on the Moolasthana, means the structural changes in the heart, as well as the physiological changes, as well as pathological changes. Means we can say that first, structural changes means there may be the cardiomyopathy like things, there may be the pulmonary hypertension like this, there may be the other type of the complication. So ultimately it is causing the variety of the Rudrog related diseases. Next. Next. So we have to consider this factor also. And very specially told in the Charaka Chikitsa Siddhisthana. And while doing the treatment, we have to, why I am emphasizing this slide, because it is very specific. And while treating the Ayurveda, we will say that Ayurveda treatment has no side effect. But if we don't observe for the Aharya and Anaharya patient, and still we do the Panchakarma, then there are chances to have the problem, or it can cause the complication in the form of Vamana Virechan or the Basti Vyapada, and that they can lead to the complication in the form of Hridayabhighata, which we are ultimately going to learn later on. So if we consider all these factors, so Acharyas have told very clearly कि if you are not observing properly Aharyata or Aharyata of the Panchakarma patient, it is going to give you complication, especially the Vamanaharya patient or the Asamyaka Vamana or Ati Vamana or Ati Virechana. Especially the Ati Virechana cause the inferior wall MI, Alpa Vamana or the over Vamana can cause the sudden hypotension like things. So we have to be focused on what we are doing and how we are handling the even Ayurvedic things also. So another thing is told that Nidanarthakar Vyadi. So Nidanarthakar means one disease is the causative factor of the other disease. So we can say that the comorbidity here. Usually we can find that many patients who are suffering from the diabetes or the other diseases like hypertension initially, later on they will land up into either the heart diseases, kidney diseases, or the other diseases. But related to the Hridroga, we can see that the many patients of the diabetes ultimately land up into the Hridaya Roga, because this insulin resistance can cause the deposition of the immature fat in the body, especially atherosclerotic changes are more faster. There will be the high blood pressure as well as peripheral neuropathy, and ultimately this will land up into the Vyadi in the form cardiac diseases in the form of variety of presentations. Next slide please. So we consider the Samprapti of the Hridroga. Dushitva Rasamdosha Viguna Hrudayam Garda Hrudivadam Prakurvanti Hridrogam cha Prachakshate. So here we can consider all earlier we have considered the factors like means hetu. In this hetu we have seen that many hetus are responsible for vata prakop, some of the responsible for the pitta prakop, some are responsible for the kapha prakop. So dushayitva rasam dosha. So what it will make the rasa dushti initially, and as the hridaya is the sthana of the rasavas srotas as well as the pranavas srotas. So ultimately, sthana dushti means the structural as well as the functional dushti of the heart will be there. So we can dushitva rasa. We can consider this in the form of thickening or the hypercholesteremia of the ultimately present in the blood, as well as increased blood urea, increased creatinine level, increased platelet agglutination. These all can be considered as the ama or the sama rasadhatu. As it is a dense or the thick, it is slowly circulating in the body, and wherever already there is a dushta sthana, Rudi Badam Prakurvanti. Wherever the Hridaya is ultimately damaged, Sthana Vikruti, or we can say that the ultimately wherever the Sthana Vikruti is there, there will be this vitiated dosha will get the Sthana Samshaya and ultimately causes the Hruday Roga, which can be in the variety of the form. So there is a main dushti in the Agni, where Ras Jataragni and the Raktadhatvagni will be there. We can see that here srotas are involved with the mainly rasava srotas, rasaraktava, and anubandha is medova srota. So we can find the ultimately the arm which has formed the adya rasadhatu, which is more sticky, and that's why it is arm ke jo properties hai, that is uh, snigdha, pitchila, guru. So it is difficult to circulate. It will heavy. So there will be the increased blood pressure, because to pass thick blood, it automatically needs the pressure, and which result in the form of high blood pressure, as well as it can present in the form of atherosclerosis changes. So many changes will be observed. Then Sroto Dushti, you can see Sangha and the Ati Pravruti. Sangha, why? Sangha means nothing but the uh, stagnancy at one. This why from there is a plaque formation that can be considered in the form of Sangha. Why Ati Pravruti? Because there is a formation of Medo Dushti will be the more strong, and this Apachita Meda will be depositing all over the body as well as the inner lining of the arteries and the veins, and this Ati Pravruti is ultimately once again causing for the Sangha. So, and the Udbhava Sthana is Amashaya, because whatever you are taking the Ahara, that is the main culprit. Then Sanchara Sthana Sarva Sharira. Why it is called as Sarva Sharira? Because the Vyanam Sarvascha Sharira Sancharitam, and as the Vyana Vayu is circulating, responsible for the circulation, so the effect will be seen all over the body. Vaktasthana, especially Hridaya area, Uristhan, as well as the Vedana which is visible on the chest, as well as the effect is seen all over the body. Roga Marga is Madhyama, because Madhyama Marga, why? Because they, which are the Marmagata Vyadis, are considered as a Madhyama Marga, and they are difficult to treat. This is very clearly told that all the Madhyama Margagata Vyadi are very difficult to treat. And one thing I will like to share here, the doshas which are present in the Abhyantara Marga means Antra, they can be cleared by the Ubhaya Marga means Vamana, or the Adho Marga means the Malavirechana. The doshas which are present externally means on the skin, they are cleaned by the external application. But those are which are present in the Madhyama Marga, they are very complicated path, and here you have to be very creative in handling the cases. In such a case, what you have to do, you have to give the Mutra Virechana, and you can see that all the cardiac patients can be handled very well by giving the any type of the diuretics, because they are all the marmas, three marmas are interlinked. That's why if you give the virechana, mutra virechana, the disease will be getting subsided. Next slide, please. So in such a way, we can see the Hrudroga. So we will focus. Purvarupa are not explained anywhere in the Acharya. The reason behind is that the span, we can say that earlier the symptoms are very subtle, but that cannot be found out. Or many a times symptoms are misleading, so the Purvarupa are not found out. But the rupa are very, very common, and all the rupas which are explained in the context 1,000 years back are exactly parallel with the today's area also. So we can see these symptoms: Vaivarnya Murcha, Jvarika Sikka, Shwasa Vairasya Tusha Pramoha, Chardi Kapotklesha, Rujo Arichascha, Rudrogacha, Sur Vividastadane. So I will explain the Vaivarna. Vaivarna means Vivida, Vigataha Varna. This Vaivarna can be the pallor, which is caused because of this pallor is caused either very low hemoglobin. This can lead to the complication like the ischemic heart disease, because there will be the supply and demand disproportion. So if the hemoglobin is less, the circulatory hemoglobin will be the less, and that ultimately cause the ischemic pain. Second thing can be there, Vaivarana ke under ही there will be the reddish color. I have seen this red color malar flush, which is sign of the mitral stenosis, and that is also comes under the malar flush is very common in the mitral components or mitral regurgitation, mitral stenosis. So that also we have to count. Next, Vaivarana can be the bluish black coloration of the lips and the this tips. We can say that this is the cyanosis. Cyanosis is because of the very low oxygen saturation that can cause, because either the person is not able to respire properly, means the origin from the pranava srota, or third reason maybe there is a external whatever the circulation that is not well, so it lead to the cyanosis. Means if we are considering the component, central cyanosis is more common in the cardiac cases, peripheral cyanosis is common in the other diseases. So when we are thinking about the cardiac component, the central cyanosis, malar flush, or the paleness all comes under the Vaivarna. So we have to consider, just when we consider the one word Vaivarna, we have to think of the many diseases, like this disease, that disease. So once we find out the Vaivarna, our focus should be on the many other diseases also. Next is the Murcha. Murcha is the reason for, that there are coronary sinuses, as well as from the aorta the blood is circulated to the coronary arteries itself. And if there is this circulation is not proper, the person will have the syncopal attacks. So that is called as a murcha. This is the one reason for the murcha. So if we find out the murcha symptom, we have to focus on the 4 more reason for the murcha. First is related that the heart is getting less circulation. Secondly, we have to consider on the focus on the component of the, there is a SA node, and which conduction system where SA node is the starting of the conduction in the heart, which is converting to the AV node, and from this AV node bundle branches and then complete heart. So when the SA node is not able to work properly, means it is not able to make the contraction beat, it will cause the intermittently syncopal attack to the patient, which can be identified in the form of missed pulse beat in the peripheral. If you palpate the pulse of this such a fainted person, intermittently you can find out there is a missed beat, which is a sign that SA node is not working well. The same thing can be studied in the form of ECG, and you can observe that the P wave is absent. So this will tell you that the person is suffering from the murcha will be there, but the reason of murcha is nothing but there is a sick sinus syndrome. Means you have to treat the SA node of the heart. Or you can be the second reason is very low hemoglobin, which also lead to the murcha. Third reason behind the murcha in the cardiovascular is there is a very low BP, and that's why there is a rasa circulation is not possible, and which will lead to the syncopal attack. The fourth reason for the murcha symptom in the cardiovascular disease is related to the that the person is having maybe having the if you palpate this, there is a vagus nerve and this carotid that carotid sinus. If you do the massage, there will be the sudden syncope can happen. Means if there is a problem in that area also, the person can have the murcha. So there are one symptom, but the single symptom is explaining you about the possibilities of the many other heart diseases. So our focus should be so wide that we have to consider each and every component. So rule out this, do the differential diagnosis, and make it clear that why this symptom is coming. Next is the jwara. Jwara is the commonest symptom in the myocardial infarction, because the platelets will the WBC count will suddenly increase, and that count will be very high, near about the 20,000. And this second reason for the jwara, there may be the carditis, inflammation of the myocardium, there may be the subendocarditis, or there may be the rheumatic fever. So all of these different cardiovascular disease will have the single symptom of the jwara. So this jwara related to the Hruday, you have to do the differential diagnosis. Then Kasa and the Hikka. Kasa is also very common in the Hridroga, but when not all patients will have the Kasa, but the Kafaja Hridroga patient will have the Kasa as well as the Shwasa. Means Kafaja Hridroga patient means which are having the congestive cardiac failure. CCF patients will be having the this problem of the Kasa and the Shwasa. But one thing I will like to explain regarding the Shwasa of this patient and the Kasa, that patient will have particular type of the Kasa at midnight Kasa, usually 2 to 3 o'clock. He will suddenly wake up with the uneasiness, little bit sweating, or the ghabrat like symptom, and then patient will have the paroxysmal dyspnea as well as the continuous bouts of the cough. So this is very peculiar, and when patient take rest or take a deep breath, it starts little bit subsiding. Because why this happens, in the lying down position, there will be the increase right ventricular pressure, and which can causes more obstructive changes, ultimately causing more retention of the fluid in the lung, and this can lead into the form of the cough and breathlessness. So this is a what to evaluate it very well and find out the congestive reason for the congestive cardiopulmonary. Then asya vairasya is the sign present in the many of the patient, because when there is a right heart failure, it causes pressure increase the inferior vena cava, and ultimately the portal hypertension, causing stretching of the liver capsule, and which will lead to the changes in the HGOT PT also, and indirectly it will lead to the asya vairasya like sedum, nausea, vomiting like sensation, bad taste to the mouth. Third one is the trusha. Trusha means the thirst. The thirst reason is present because of there is electrolyte imbalance present. Whenever there is a severe electrolyte imbalance, the patient will have the symptom of the thirst. You know that the cardiac cycle is activated by means of the sodium potassium channel, and when the sodium potassium channel get disturbed, the patient will have the symptom of the either hyperkalemia, hypokalemia, which can be found out as in the form of arrhythmia or sudden attack, sudden stoppage of the heart, or there may be the many other symptoms which can be studied in the form of ECG. ECG will identify, but the patient's symptom will be the high thirst. So we have to immediately evaluate by taking the ECG. You can ultimately find out the reason why this is happening. Then Kapotklesha. Kapotklesha is in the form of either sputum coming out the vigorous sputum, which can be frothy, which can be pink in the color, and patient, especially of the congestive cardiac failure patient, will have the such a symptom. So all these are the symptoms commonly found out. That's why it is called Rudrogacha Samanya Lakshanam. And there will be the very peculiar symptom in the Vatic type, Petic type, and the Shlemic that we are going to find out later on. So next, ma'am. Yes, next slide, please, ma'am. So we will see about the Vatika Rudroga. Vatika Rudroga is means there are three doshas are always predominant, but out of that, when Vata is more predominant, it will produce the certain symptoms. That's why it is called as the Vatic type of the Rudroga. Nidana are the always which are Vata Pradhan predominance, means where Ahara, Vihara, all are the causes Vata Vikruti or increases Vata Prakopa in the Sharira, and ultimately more symptoms like the ischemic heart disease. Next slide, please. The symptoms are very, very peculiar, like the ischemic heart disease. Explained. So, Vati ayammate marutaje rudrogam tutyata tate nirmattate diryate sputtate pattate. All these symptoms is stretching pain, pricking pain, churning pain, cutting pain, pricking pain, stabbing pain, tightness in the chest. All these are the variety of the pains explained by the patient are coming under the ischemic heart disease. And we can see that many of the patients coming in the OPD or the IPD with the chest pain or variety of this, डॉक्टर साहब टाइट चेस्ट में टाइट फील रहा है, घबराहट हो रही है, कुछ सुई चुभाए जैसे हो रहा है, या कुछ तो मचलने जैसे हो रहा है. All these are nothing but the related to the Vatika Rudriva. Why this has happened? Because Vata is responsible for the Sankocha in the nadis. So here the nadis are related to the Rasavas nadi, means circulatory arteries and the veins. So circulatory arteries, when get sudden spasm or the contraction, or there is a any type of the obstruction, these are causing the Srotorodhajanya Vata Prakopa, and ultimately the Vatika Rudrogajanya symptom is IHD like symptoms will be developed. So our Vatika Rudroga we can consider as the ischemic heart disease. Next please. Next slide, please. Yeah. We can compare or do the differential diagnosis in the form of sometimes confusion, whether it is a skeletal pain is there or the cardiac pain. Many times this happens, patient comes to you and you are in the confusion. So we have to differentiate the patient in this regard. And here are the cases that the patient is having the presentation efforts. The patient will have the main pain that emotionally aggravating. मीन्स पेशेंट बोलता है कि भाई थोड़ा सा भी सोचते हैं घबराहट होती है या कुछ स्ट्रेस आते ही मुझे दर्द बढ़ता है, बट दिस इज नॉट इन द स्केलेटल पेन. द पेशेंट विल हैव द कंटिन्यूअस पेन एंड स्पेशली इट इंक्रीजेस विद द एफर्ट्स एंड अदर थिंग्स. ऑनसेट जो है वो कार्डियक पेन में यूजुअली देयर विल बी द यूजुअली कोमॉर्बिडिटी यूजुअली सीन, बट दिस इज नॉट ऑब्जर्व्ड इन द स्केलेटल पेन. इलनेस जो है ड्यूरेशन कार्डियक पेन में जो रहता है कि relatively a long duration रहता है, slowly and frequently patient is observing this scene and he may be explaining that intermittently he is having the chest pain, or when he do the some efforts or he hikes the staircase, that time only it is aggravated, otherwise he is fine like that. But in the skeletal pain this is not, there is a main reason will be there. If you take the family history, many of the patient will have the premature deaths in the this, but skeleton pain के लिए ऐसे कुछ नहीं रहेगा. There may be the trauma or something will be there. If you find out the radiation, the cardiac pain or the IHD pain, patient pain will be radiating to the left arm, It can be radiate to the teeth, neck. It can be radiating to the back. So there may be a lot of radiation, but muscular pain may not be like that. And the one more very important thing, that if it is a cardiac pain, it is very intense. So patient has to stop. Patient has to stop. This is a identifying or distinguishing picture in the cardiac pain and the skeletal pain. In the cardiac pain, he must stop, and he will, when he stop, he will feel comfortable. But skeletal pain में कैसे patient, though it is a painful, he can do the work. That is a very different thing. Next, ma'am. Next slide, please. So we will move to the Paithic Rudroga. In the Paithic Rudroga, you can see that there are many reasons like Ushna, Amla, Lavana, Ahara, Katu, Bhojan, alcohol, and stressful mentality, irritable personality, or the Krodhi person. All these are increases the Pitta in the Sharira. And Pitta has a tendency to make the Klama in the Sharira. Means Klama is nothing but the Shrama, means the person feels tired after work. But Klama is the thing which is felt without doing any exertion. Patient feels the tiredness. This is the specialty of the Paithic work. Patient is not able to do any activity. He always feels tired. And many patients are not able to complete the single sentence also. This is very peculiarity. So those who are having the many history of the long-term alcohol drinking or the smoking, they may majorly have the Paithic Rudroga Nidana, or the patient who are suffering from the long-term tooth problems. They are secondary responsible. Means we can say that subendocardial endocarditis. The reason for this is the infection, and the origin of the infection is from the tooth or the infected boils or infected skin which is moving to the heart. So they will end up into this type of the symptoms. Many times Paithic Rudroga and the acidity is confused in the OPDs, and a severe acidity must be taken care, because it can be the sign of inferior wall MI also. So this should not be taken very lightly. At this, when you are considering Paithic Rudroga, the ECG must be taken, or whenever there is a severe acidity, it should be evaluated for the inferior wall MI, which mimics very similar to the acidity. So it should not begin. An elderly patient with the acidity as well as the loose motion, 100% take care that, and he should be observed for the longer duration, because it can be the this can be the undergoing the changes of the slow and steady changes of the inferior wall MIs. Next, Paithic Rudroga has the certain this Shleshmic Rudroga has the certain symptoms. This is caused because of the increased type of the Kafagara Ahara Vihara, which increases the kapha or the lipoproteins. LDL level is increased, VLDL level increase. Means we can say that the circulating in a cup, this rasa is thick, dense, as well as you can see that the kapha coming out, that is also the dense. The reason behind that Kafakara Ahara Vihara means the causes which are increasing rasa viscosity, as well as the increasing the hypercholesteremia in the variety form. So there should be the need of doing the lipid profile, which will guide you very clearly. Hyperlipidemia is one of the cause for the Rudroga. So that the presentation is in the form of Gaurava Kapha Sanstravo Stambo Agnimardam Cha Madhuryam Chasya Balavasata. It's here another symptom is Shleshmana Rudayam Stambam Bharikam Ashmagarbhavatam. So here you can find out that patient will explain you very peculiarly. The person is feeling heaviness in the chest, as if someone has kept a big this thorn, or the big you can say that the heavy load over the chest, and he is not able to breathe properly. He feels the tightening in the chest, as well as continuous salivation is coming. So these are the signs, and as well as difficult to breathe, and the patient is having so much difficulty in the breathing that he has to take some support, and he will hold that support so that his accessory muscles of breath, means our pectoralis major, as well as spinatus muscles, sternocleidomastoid muscle, these accessory muscles will help for the respiration, which is not possible in the lying down position. So patient will sit down and then he will start breathing with the support. There will be intercostal muscle recession. So this is a tightening plus all these symptoms. Hrudaya bharikta, heaviness, numbness in the chest. This is secondary to the congestive cardiac failure. There will be there may be the increased viscosity of the blood. There is the increased hypercholesterol. So all together they will land up into the such a symptom, and we have to evaluate it this very plug. If you do the echocardiography, you can find out that to do all this, the thickened rasa, to propel this, the heart has to do a lot of efforts, and this will lead into the hypertrophy of the chambers also. So the hypertrophic chambers can be found out over the 2D echo. Next slide, madam. Yeah. So here is the differential diagnosis. The patient came to you now, whether he is having the cardiac shwasa or the tamaka shwasa. This many times it is a confusion. See, in the old age, it is not much confusing, because if the patient is having the sudden history and there is no previous history of the attacks, that intermittently unable to take the breath, or the coughing and the breathing, and this dyspnea is suddenly started over the 48, then this is related to the Hrudragoshwas. And if the patient has a history of the hypertension, ischemic heart disease, or the aortic heart disease, then it will be the Hrudragoshwas. But in the Tamakashwas, usually the family history will be there. Mother, father, some of will be having the history of the Tamakashwasa. They may have the history of the allergy. They may have the history of the sudden food intake, which is not palatable to them. Or there will be the dyspnea attacks intermittently also. So that is for the Tamakashwasa. If we consider for the status of the blood pressure, Rudragoshwas, there will be the high BP. But in the Tamakashwas, either there will be the normal or the low BP. Pulses, if we find Rudragoshwas patient, if it is there, there will be the bounding pulses. Means the pulse will be full volume, very filled below the 3 fingers, and it needs some more pressure to close. But Tamakshwas, the pulses are very feeble and the rapid. So, and if you take the chest, you can find out that there is empysematous chest. What is meant by this empysematous chest? There is a dilatation of the permanent dilatation of the chest, which can be found out on the over the X-ray. You can count more than 7 ribs, as well as there will be the hyperlucency over the X-ray. So ultimately, this will show the picture of empysematous, which is the presentation of Tamakshwas. But if you find out the Rudrogoshwas case, there will be the more fluffy shadow. Means if you see the bases of the lung, it will be having the fluffy shadow. The bases will be having the haziness, which is suggestive that the fluid accumulation is present at the bases. And that is the sign that the fluid collection has occur in the Rudrogoshwas. So if you take the chest, if you do the auscultation in the Rudrogoshwas, there will be the more crepitation. And the reason for the crepitation is the collection of the fluid in the basal area or the dependent area. If the person is able to sit, it will be in the sitting position and the basal area. But if the patient is very old and lying down, then it will be over the crepitation will be in the back side. But in the Tamakashwar, there will be Rankai musical sound like the sounds will be present in the tamak shwas. So like these symptoms will be observed. In the Hrudroga Shwas, I have already told the patient will always respond to the Madhyam Marga, and the diuretic response will be the very best. So if you give the one diuretic shot, either you can give the Lasix or you can give our Gokshura Digugul, it works out very well and patient get immediate relief. In the Tamaka Shvasa, this will not work out. So if you want to do the Upashaya and Upashaya also, that can be done over this. But Tamaka Shvasa patient will be getting the Upashaya with the either amino following or the our Tamak, this Shwas Kuttaras or other medicines. Next, please, madam. So Tridosha is a Hrudroga. Here we can see that Vata, Pitta, Kapha, all the three symptoms are there. So Vidyata Tridosham api Sarvalingam cha. So whatever we are seeing, chest tightening, chest pain, burning, then low BP or high BP, vomiting sensation, trusha, pramo, all these are togetherly present, and that is the Tridosha Hrudroga. So if we consider our myocardial infarction cases, they are considered as a Tridosha Hrudroga Lakshana, because there is a severe pain as well as all the symptoms are very predominantly present, and which needs the if it is a single vessel disease, it is manageable. The age also matters. The heart disease or the cardiac attack present in the elderly patient is manageable, but if it is in the young patient, it is not manageable, or it can cause the sudden death. So there is a inverse proportion. Usually हमेशा हम क्या बोलते हैं कि यंग लोगों में हुआ व्याधि साध्य रहता है और बुढ़ापे में हुआ व्याधि कष्ट साध्य या असाध्य रहता है. बट हियर द केस इज वेरी इनवर्स. अगर यंगस्टर्स को हुआ हृदरोग है तो वो हृदरोग इन द सेंस इफ इट इज स्ट्रक्चरल इट इज मैनेज बाय द सर्जिकल केसेस, but if it is a Tridosha Hrudroga means MI, it is not managed. Heart attack in the youngster is more dangerous than the older patients. Then Krumija Hrudroga. This is a different entity explained by the Ayurveda only, which is not considered by the modern people. So we cannot have the exact parallels of the Krumija Hrudroga, but one thing we can explain still nowadays also, कि whatever the points explained by the acharyas, कि reason is तील क्षीर गुड़ादीनि ग्रंथि संजोपजायते मर्मकदेश संक्लेदम रसश्चोपि गच्छति च, and it will result in krumi bevi shavanetrata tama pravesho ullasam shoshakandu kapasthrutihi hrudayam patanam cha. So if you consider both the positive factor as well as the symptom, we can find out that the person already suffering from the worm infestation. The person may be the hookworm, pinworm, tapeworm, whoever the type of the infection. This infection predominantly presiding into the intestine, and these are sucking the blood from our gut, and it is ultimately leading to the this anemic stage of this. If this is for a longer duration, if this patient are having the worm infestation from the longer duration, it ultimately causing the anemia of the longer duration, as well as when the person is anemic for the longer duration, it will lead to the symptoms similar to the shavanetrita, means blackness around the eyes, which is nothing but the sign of the severe anemia sign. Tama pravesho means the darkening in front of the eyes. It is nothing but the this darkening because of the low hemoglobin. Rullasa is because of the nausea causing from the worm infestation के कारण जो होता है. Shosh also because it is continuously absorbing nutrient. The person is now malnourished and ultimately he will be losing the weight. Kandu is the kapha. It is kandu to the skin as well as kandu to the anal region. So we can consider this kapha struti. Kapha struti here we can say that the nausea and the vomiting. Many a times the patient is having these vomiting symptoms, and in that vomiting you can see the small pinworms or the threadworms present. Hrudayam cha pratatam cha. Here what they are told, granthi stopajayate marmeka desham cha. Here they have explained that sometimes what happened, if these tapeworm are very long, or the ascaric lumbricoids are very long, they have the tendency to go and block the circulation. They can block the circulation of the this heart. They can block the circulation of the lung. They can block the circulation of the aorta, and that's why it can produce the sudden complication. So when we consider about the Krumija Hrudraga, which is not told by the modern people, but it is very nicely explained in the Ayurveda, so we have to focus this. And if you do the stool examination, this can be cleared also. And the patient with the severe low hemoglobin, you find out this the reason behind that. Otherwise there is no reason for this, but the patient is suffering from the anemia because of the worm infestation. Then first you have to treat for the worm infestation, then the other disease is possible. Why there is a marmaika desha sankledam? Because these worm or the pinworm, they goes and start eating our muscles, and which is very painful. So it is called as the cutting type of the pain. Maharujam shastrena chiddamanem cha. The pain is so severe that the patient will have the cutting type of the pain. जैसे कोई सौ लेके आरा वगैरह लेके कट हो रहा है. So this is a very classical entity explained by the Ayurveda. Next slide please. Next slide please. Then Rutshula. Please show the slide of Rutshul. Rutshul, next slide. Yeah, Rutshul is explained by the Sushruta only, but it has a very parallels with the angina pectoris. See, kapha pittavarastu maruto rasamurshitaha hrudayastha kurutyam shulam uchchavasa varodam praram so Rutshula iti khato rasamaruta sambhavaha. So what they have told, whatever the process explained by the Sushruta, it's just similar to the causing of the atherosclerotic changes. Kapha pitta avaradastu. So kapha pitta has causing the stickiness or the increased viscosity, ultimately causing the decrease the circumference or the atheromatous plaque in the vessels, and rasamarutaha. So what happens? It is causing sanga. That's why the circulation, which is the work of the Vyana Vayu, which is get sanga, and so the Vayu get prakupita, because it is a margavarodha jannavada prabhava, and this margavarod now causing the vikruta direction. And because of this, depending on how much the artery is blocked, if it is 50 to 70%, the person will have the stable angina. Means angina is nothing but the chest pain, which is causing the intermittently. Means whenever there is a heavy workload or the stressful activity, that time there is a need of more blood circulation. But the as the circumference is much diminished, the circulation is not adequate, which will lead into the pain. That is called as the angina. But what happens? This frequent pain now we can call as the angina pectoris. The chest pain is continuously there, and this is called as the Rutshul by the Sushruta. But when this Rutshula, it causes complete obstruction. At one point, when the heart is completely vessels are completely blocked, means almost 95%. I'm not telling about the 100%, because 100% if it is causing the tridoshas type of the Hridroga, that is nothing but the myocardial infarction. Here it is causing the block, And as it is here, rasa is also responsible as well as the vayu also responsible. So that is Acharya has told rasa maruta sambhavaha. Means here we have to consider the possibilities of the viscosity. Means here we are using antiplatelet drug or the scraping reagent like Arogyavardhini Vati and all this, or the dravyas this Rudibadha Karan Vati, like this drug can be used. Here vata shaman करने के लिए हम बस्ती दे सकते हैं, that is मृदु बस्ती दे सकते हैं. So all component we have to consider, and or you can do the this जो बोलते हैं ना जारू बस्ती टाइप, या जो ऊपर चेस्ट पे करते हैं स्थानिक बस्ती, that type of the local bastis can be done. Next is Hrudayabhighat. This explanation is not coming directly, but the Hrudayabhighat explanation is done in the Siddhisthana by the Charaka. This is related to the complication of the Vamana Virechan or the Basti. If these things are not properly done, I have already told that we are going to check this later on. So Hrudayabhighat happened when improper management of the Panchakarma. So this will Balakshaya Kantha Shosha Kloma Karshanam Jivva Nirgamanam Mukhatalu Shosha. There will be cough, breathlessness, weakness, dryness in the throat, epigastric discomfort, protrusion of the tongue, dryness of the tongue, mouth, palate, convulsions, irrelevant speech, abnormal function. Why this is happening? Because this is nothing but the vasovagal syncope. This is usually happen. We know that heart is supplied by the vagus nerve, and vagus is the sympathetic nerve. So vagus brake are there. Sympatho accelerators and the vagus brake. So when there is a vagal stimulation because of the fear, because of the trauma, or because of the sudden any changes, patient will land up in the vasovagal syncope in the form of low BP, severe discomfort, throat discomfort, protrusion of the tongue. He will have the dryness of the mouth. He will have palpitation, low, then thready pulse. So many things will be there. Why this is happening? This is because of the low output happening, and because of the low output, heart is not able to expel the blood in the periphery. And in this regard, sudden decrease in the blood pressure causes the neurocardiogenic syncope, and this is nothing but the Hrudayabhighat. So if we are observing such symptoms while giving the Panchakarma, we have to treat it very vigilantly and very energetically so that we can save the life. Okay. Next, Hrudaya Vidrati. Luckily, Hrudaya Vidrati are not easily observed. These are observed by the, we can say that accidentally in the patient. Means the abscesses in the Hrudaya, endocarditis may ho sakta hai, pericarditis, they are not regularly observed. They either observed for the suddenly doing 2D echo for the other cases, or the patient may be having the prameha, shwasa sudden, or the comorbidity, or there is no verified reason for this, and such a Vidrati suddenly burst, the patient may be die. So such a type of the cases are very rare, which is not observed regularly. Patient may be having the chest pain and other symptom, but relevant finding is not getting. If he underwent 2D echo or for other reasons also, then simultaneously finding can be observed, and that reason for the Hrudaya Vidrati. Next. So Hrudrog, ultimately, if the person is having the Hrudaya Roga, this is related to the rasa, and rasa ka karya hai prinanam jivanam, prinana tarpana, But if this prenana work is not done for the longer duration, then what happened? The person will go slowly malnourished, uh, and in the subsequent, means we can say that day by day the other subsequent dhatus will be also the weak. And what happens because of this weakness? Every dhatu will be the so weak that the patient will end up into the uh, certain cardiac complication like klama, sada, brahma, shosha, and krumi udbhava. So here, this situation it is called as the cardiac cachexia, means the person causing lean thinness, but the reason of lean thin is cardiac disease. He is not having the weakness or the leanness because of the other disease, rather he is having the complication of the cardiac problem. So that's why we have to see this brahma also there, because if we have not treated the sick sinus syndrome, means SA node is not replaced, the sick SA node is not replaced by the artificial pacemaker, he will have the permanent brahma lakshan. So it should be taken care and to find out this. Then sadhya sadhyata, all the hridroga are the kashta sadhya or the asadhya also. Arishta lakshana are always seen, and arishta lakshana the patient usually die within the 3 to 7 days. Here very clear cutly told in the Indriyastha that vatashtila samruddha tishtanti daruna vrudi. Trishna abhiritasya sadhyo mushnati jivinam. Here sadhya means 7 days. Within a 3 to 7 days. Even also, whenever the patient underwent any cardiac procedure, doctor always tell you that 7 to 2 hours are critical. And then he will tell that we will take care or keep the patient 7 days in the ICU. Later on, we will see whether to move in the recovery or not. Why? Because they are very critical. It can be the arishta bhasa, means the symptoms looking similar to the arishta, or it is the arishta. So sometimes it is not explainable. So better to take care that considering the arishta lakshana, handle the patient very vigilantly. Next case, next slide, please. So these are the some laboratory support we have to take. HB%, why I told that anemia, polycythemia. Anemia is the low hemoglobin, and when there is a low hemoglobin, it can cause the paleness symptom as well as it can cause the cyanosis symptom also. Because low oxygen hemoglobin cannot cause the purely good oxygenation, and ultimately it collects some more carboxyhemoglobin in the body. Secondly, polycythemia. If there is a excess hemoglobin, that is also not good, because polycythemia vera is the stage of the hemoglobin where the hemoglobin percentage is very high, more than 18 grams per deciliter, and that is not good because it causes the excess stickiness of the RBCs, WBCs, and the platelet, and which makes the difficulty in the circulation, as well as it causes the breathlessness also. Then TLC, total leukocyte counts, because this will give the guidelines regarding whether infective endocarditis is present, or especially the this neutrophil lymphocyte ratio is very important here. NM ratio is very important in the cardiac, because this ratio will guide you. The more the leukocytes, there is a more harm. Usually in the first week of the MI, there is a very high WBC count, especially the polymorpho-neutrophil counts. Means neutrophils will be the high. ESR and the CRP, if it is a rheumatic heart disease, ESR will be raised. If CRP, then there will be the CRP is raised. 5 से ज़्यादा है तो it is a recent infection. Then blood glucose, we have to find out the comorbidity, whether the patient is diabetic also, because many of the patients, those who are having presented as a heart patient, they are unaware of that they have the diabetes also, and at that time when you do the first time blood test, it is diagnosed that he is the diabetic, and then all the cycle will be identified that this is the he is having the HbA1c very high, which is guiding you that the long term glucose level has now converted into the Nidanarthakar Vyadhi in the form of heart disease. Patient sometimes may be the hypoglycemic. So the concept I told, Murcha, here if the patient is having the low glucose level, which can be represented in the form of Murcha, which may be not the cardiac reason, but which may be because of the low sugar level also. So we have to take in the consideration what may be the reason. Then lipid profile. I told you that lipid profile is very responsible for causing the Sama Rasadhatu, because it is increasing the Sama made in the blood circulation, which can make the plaques and other suitable situation. What we can say that the Rasavahini Dushyanti, so it makes the Rasava Sruta Dushti ke liye, it will make the site. Then cardiac enzymes, CPKMB, which is a confirmative for the MI, and troponin T test, which will highly help you to guide the sometimes what happens, we can identify the myocardial infarction on the base of ECG by the ST elevation. But some of the cases there is ST elevation is not present. That is called a non-ST elevation myocardial infarction. In this case, we can identify the situation where that patient is having the MI by the troponin T test. So it is the guidelines for this. So though it is a Tridoshajanya Hridroga, we can definitely take the help of the all modern parameters also. Next, please. So renal profile is also essential. I told you that Trimarmiya Adhyay. The Acharya Charaka has explained all this pathology in the Trimarmiya Adhyay. And in this Trimarmiya Adhyay, you can see that Hrudaya Basti Marmam. Hrudaya Basti and the this Shiram. So if there is a one marma is vitiated or one marma disease has happened, means cardiac patient will have the comorbidity, or he can produce the comorbidity related to the kidney. He can produce the comorbidity related to the brain also. So there can be the many complications related to the means origin from the heart, but it can make to the complication to the kidney as well as brain also. Even the kidney problem patient will have the high blood pressure. It can ultimately land up into the problem of the heart disease also. So to check out the comorbidity, we can do the renal profile. You can find out the increased creatinine level. You can find out the increased blood urea level also. If there is an increased blood urea level, we have seen one symptom in the first Vaivarna Murcha Jvara Kasa Hikka. Hikka symptom. The Hikka symptom is observed by the renal profile. If the blood urea level is increased, highly increased, it will cause the uncontrolled hiccup in the patient. And this is not stopped by the any medicines unless and until you recover this blood urea level to the normal. But if it is a Mahahikka or the Gambhira Hikka related, then the origin will be definitely from the increased blood urea level. So always take care that the renal profile should be done in any cardiac patient. Electrolytes, I already told you that there is a need to check always the serum potassium, serum sodium, and the calcium, because hypokalemia, they can evoke the lethal cardiac arrhythmia, irregular heart beating, and which can ultimately lead to the many complications. Because of this legal arrhythmias, there can be the VT, ventricular tachycardia, supraventricular tachycardia, heart blocks, and other complications which can suddenly take the life of the person. Blood culture is very not responsible for the each and every patient, but if you are suspecting that the patient's fever is not coming down, and there is a previous history of the tooth decay or the previous history of the near surgery, and any small what you can say embolus, fat embolus, or the any organism emboli has entered into the heart circulation, which has now caused the problem to the heart and leading to the infective endocarditis. In such a patient, better to go for the blood culture. You can find out the reason and which organism is there, and that can be treated very well. Then anti-strepsilacin O, this is called as the ASO titer, which is not done in the each and every cardiac patients. But if you are suspecting that the patient is having the rheumatic fever or rheumatic carditis, in this case you have to do the ASO titer. The ASO titer about 200 Todd units is supposed to be the significant for the cardiac involvement. So if there is a involvement of the suspecting that there is a rheumatic carditis or valvular infection, valvular involvement, better to do the anti-streptomycin only. Urinalysis also to be done for the hematuria, because many of times hemoglobinopathies will lead to the hematuria, that to be find out the reason behind the is especially secondary to the endocarditis. There is a hematuria also happens. This diagnosis can be done by the ECG. So I have told that many of the cases have been diagnosed on the basis of the ECG, like P wave is absent, means in all the leads, then it is a six sinus syndrome, or intermittently absent, that is also suggesting of the six sinus syndrome, means SA node is problematic and we have to treat for the SA node and do the either it is a temporary management of the pacemaker or permanent management of the pacemaker. Secondly, ECG will tell the many cardiac arrhythmias, even the electrolyte imbalances can be identified. MI can be diagnosed very urgently or within minutes or the seconds on the basis of the ECG. So it is a very primary and the easy to understand diagnostic approach for the cardiac disease diagnosis. Next. This is a treadmill test, which is not advised in the each and every patient, but the treadmill test is advised the patient who are telling that the pain observed after the certain distance, or if they do certain activity only, otherwise they are comfortable. So this is the exercise testing. So how much time, after how much time the patient gets the breathlessness or the dyspnea or the ventricular tachycardia or any other dizziness. To find out this, we are doing this particular type of the monitoring by the treadmill test, and another is the Holter monitoring. So few patients are having the arrhythmias which are not identified on the ECGs. Means after 1 hour or 2 hours, this much long ECG strip we cannot take out. In such a situation, we have to place this ambulatory ECG monitoring, that is called as Holter monitoring, stuck to the patient's chest and then observe the cardiac arrhythmias. Means that can be recorded, which can be downloaded in the computer, and we can treat that patient. Okay. Then next exercise. This is a tilt test, that is called as HUT, head up tilt test. This is also not done in all the patients. Those patients are completing the murcha symptom or the giddiness or intermittent syncopal attack. In such a patient only this head up tilt test is done. Means the person is fixed with the all monitors, means उसका BP probe लगाया रहेगा, chest leads लगाए रहेंगे, उसको ECG monitor को connected रहेगा, and he may be first screen you can see he made the standing, and after some time that long duration he will stand, and then suddenly tilted to the that next picture you can see it will be done cross almost up to the certain degree, like 90 to 70 degree, and patient will develop the either arrhythmia or many changes fall in the BP, and so this will be the diagnostic that patient is having that type of the bradycardia, or he will have the sudden decrease in the pulse rate and he will have the syncopal attack. So like this we can find out. Next, angiography. Everyone knows the angiography is the easiest method to identify but this is the invasive method to identify the blockages in the heart, which is finding out that Srotorod or Stranga, and we can give the medicines of the scrapping reagent to get this. Next is this echocardiography to do the real time functioning of the heart. Means whether heart is contracting properly, all the chambers are working well, or there is certain chambers which are not able to contract well, or certain only one part of the wall is not contracting. To see the flow dynamics of the blood circulation, to observe there is any congenital anomaly like excuse me, atrial septal defect or ventricular septal defect. So all these segments, there can be the hole in between the atria, there can be the hole in between the two ventricles. So that can be observed by the echocardiography. You can find out the pressure gradient changes as well as the flow changes over the echocardiography, which will make the diagnosis, as well as patient can be managed after doing the surgery. This ASD VSD can be closed. So all these things are to be done, and these we have to consider Ayurveda aspect as well as the modern aspect. We will help the patient in the aspect of what foods not to be taken, what care to be done, and whenever you why I told about the modern also. If we are not able to treat that patient, that is also the fine. But referring the patient at right time to the right doctor and suggesting the right thing, this is also the half done treatment, and we can save the certain person's life. So there is a need of the correlation of the Ayurveda as the modern cardiovascular component, and this was my intention. Thank you very much for the patience listening, and there was a certain technical problems, but hope you understood, and thank you very much.
बहुत बहुत धन्यवाद डॉक्टर साहब, एक्स्ट्रा ऑर्डिनरी प्रेजेंटेशन। और प्रत्येक आयुर्वेदिक स्लाइड के साथ भी आपने मॉडर्न एस्पेक्ट को इतना सुंदर तरीके से एक्सप्लेन किया, तो मैं समझती हूँ कि सच में बहुत ही बढ़िया सुंदर लग रहा था। और यूजी लेवल से ही अगर इतनी डेप्थ मिलती है, तो वो बच्चे आगे जाके बहुत अच्छी तरीके से भारत की लोगों की जो आयुर्वेद के माध्यम से एक सेवा होनी चाहिए वो कर पाएंगे। और मैं एक और स्पीकर को याद करना चाहूंगी, डॉक्टर अभिषेक उपाध्याय फ्रॉम काय चिकित्सा। जब
हाँ
ऑफलाइन जयपुर
हाँ
में लेक्चर हुआ करते थे, सेम इसी
हाँ
पैटर्न से उन्होंने उदर रोग समझाया था। और
ओके
तब रिकॉर्डिंग की कोई व्यवस्था नहीं थी, तो मैंने अभी
हाँ
ऑनलाइन हो गया तो डॉक्टर साहब को कह रही थी, मैं कहा डॉक्टर साहब उस दिन है ना उदर रोग बहुत बढ़िया समझाया था, तो मैं समझती हूँ कि बच्चों को फिर सुनने को मिल जाएगा, आप पढ़ा दो। कहते मैडम क्या उदर रोग, और ही कुछ पढ़ा दूंगा। तो हाँ जी, बहुत बढ़िया तरीके से वैसे ही डॉक्टर अभिषेक की तरह आपने ये लेक्चर इतना सुंदर तरीके से लिया है ना, मैं समझती हूँ कि बहुत ज्यादा उपयोगी रहेगा और सभी के लिए पथ प्रदर्शक का काम करेगा। और अगर कोई प्रश्न है तो मैं अभी अनम्यूट कर रही हूँ, तो जिनको भी प्रश्न पूछना है वो हाथ हैंड रेज कर सकते हैं। और मैं चाहती हूँ कि हम जहाँ ऐसा लगता है, डॉक्टर लक्ष्मी नारायण जी बहुत बहुत धन्यवाद और लेक्चर की सराहना करने के लिए। तो मैं समझती हूँ कि अगर कोई प्रश्न है तो आप अपना हैंड रेस करिए, हम उसको ले सकते हैं। और बाकी आपने लक्षण बताते समय भी बहुत अच्छी तरीके से ट्रीटमेंट बताई है डॉक्टर साहब, है ना? तो ये तो बहुत ही ज्यादा एक्सपर्ट होने के बाद ही बताई जा सकती है। डॉक्टर अनीता जी वागले, बहुत बहुत धन्यवाद लेक्चर की सराहना करने के लिए। डॉक्टर किमाया, हेलो, अच्छा डॉक्टर किमाया, ठीक है। तो बहुत ही बढ़िया प्रेजेंटेशन रहा और मैं समझती हूँ कि बहुत सारे जो बच्चे कहते हैं ना कि मैडम एक बार और सुनेंगे, ऐसा लेक्चर है ये। डॉक्टर अनुपमा
थैंक यू
जी,
वेरी मच मैडम।
जी जी, डॉक्टर अनुपमा जी बहुत बहुत धन्यवाद। डॉक्टर किमाया बहुत बहुत धन्यवाद, आपका सभी धन्यवाद कर रहे हैं एक बहुत अच्छे सेशन के लिए। और अ, अभी कोई प्रश्न है नहीं, तो हम इस लेक्चर की पूर्णाहुति करते हैं। विश्व आयुर्वेद परिषद की ओर से बहुत बहुत आपका तहे दिल से धन्यवाद। इमरजेंसी स्पीकर बनने के लिए उस दिन का धन्यवाद, आज का अपना रेगुलर था उसके लिए भी मैं बहुत बहुत धन्यवाद करती हूँ। और ऐसे ही हमें आपका सहयोग मिलता रहेगा, ऐसे चाहती हूँ। और कभी इमरजेंसी रही तो भी मैं आपको कांटेक्ट करती हूँ डॉक्टर साहब, है ना। और एक मिनट, शायद एक लेक्चर, अच्छा, डॉक्टर मुग्धा एक प्रश्न पूछ रही है, रोल ऑफ सुवर्ण सूतशेखर इन हाइपरटेंशन।
या सुवर्ण सूतशेखर बहुत अच्छा काम करता है। बेसिकली क्या है, सुवर्ण सूतशेखर पित्त शामक है, और जो हमने हाइपरटेंशन जो कंसिडर किया है, दिस इज अ व्यान व्यान वायु की वृद्धि है वो। तो व्यान वायु इज सर्कुलेटिंग, सो यहाँ पे वात पित्त के कारण प्रकोप होता है। हाइपरटेंशन इज नॉट ओनली द व्यान दिस पित्त प्रकोप और नॉट ओनली द वात प्रकोप, इट इज अ वात पित्त प्रकोप। सो इफ वी टेक द सुवर्ण सूतशेखर की जो ये कंसिडर की है, क्या बोलते हैं हम उसका, यूटिलिटी जो एक्सप्लेन की है, वो वात एज वेल एज पित्त में भी बता कि सुवर्ण जो है बल्ले है और पित्त शामक भी है, तो वात को भी कम करता है, पित्त का भी शमन करता है। तो अल्टीमेटली वात पित्त का शमन होने के कारण बीपी में बहुत अच्छा, बीपी के पेशेंट में बहुत अच्छा रिजल्ट है। सेकेंडली क्या है, सुवर्ण सूतशेखर दूसरा एक काम करता है कि वो स्ट्रेस भी कम करता है। तो जब स्ट्रेस के कारण भी बीपी बढ़ रहा है तो दोनों जगह पे काम है। और जनरली क्या रहते हैं, जो गुस्सा करने वाले रोग रहते हैं उनका बीपी बढ़ता है, और पित्त कम हो गया है सुवर्ण सूतशेखर से, तो इट वर्क्स वेरी वेल, वेरी वेल। मैं बहुत सारा सूक्ष्म सुवर्ण सूतशेखर मैं पेशेंट को देती हूँ। सूक्ष्म ने उसको बहुत बार ट्रिचूर करके 1000 पोटेंसी बना के मैं सुवर्ण सूतशेखर देती हूँ। उसमें मैंने होम्योपैथी का एक कंपोनेंट ऐड किया है कि अगर सुवर्ण सूतशेखर बहुत महंगा है तो हर पेशेंट नहीं ले सकता है, तो उसको जो होम्योपैथी की टैबलेट्स आती है उसके साथ 3 आवर्स अगर हम ट्रिचुरेट करते हैं तो वो सूक्ष्म सुवर्ण शुद्ध होता है। एंड उसकी अगर हम एक मात्रा देते हैं तो इट वर्क सिमिलरली टू दैट। उसकी अलग पोटेंसी बनाई जा सकती है, और इवन गरीब से गरीब पेशेंट को भी हम दे सकते हैं जो सुवर्ण सूतशेखर अफोर्ड नहीं कर सकते। तो इट वर्क्स वेरी वेल। तो वात पित्त, वात का गुण क्या है, वो पित्त के साथ बढ़ेगा तो पित्त के गुण बढ़ाएगा, कफ के साथ बढ़ेगा तो कफ के गुण, इट इज अ संस्कार रूप वर्धते, है ना। तो इसलिए हमें बहुत ही अच्छा काम करता है, एंड रियली वर्क्स वेरी वेल। थैंक यू मैडम
जी डॉक्टर
फॉर
साहब,
योर
बहुत बहुत
एप्रिसिएशन
धन्यवाद।
फॉर।
हाँ जी, डॉक्टर मुग्धा जी पूछ रही है,
No,
इफेक्टिव
no, this is not a homeopathic medicine.
जी
No, madam, I am not giving any medicine, homeopathic medicine. I am using that plain globules. जो लैक्टोज के शुगर के ग्लोब्यूल्स आते हैं ना उनके, होम्योपैथिक के सिंपल ग्लोब्यूल्स, एनी मेडिसिन, दैट ग्लोब्यूल्स आई ट्रिचुरेट, मीन्स उसको मर्दन करती हूँ मैं सुवर्ण सूतशेखर। सपोज आई टेक द 1 gram ऑफ सुवर्ण सूतशेखर, आई विल टेक द 9 gram ऑफ द this homeopathic plain globules which is having no medicines at all, means वो शक्कर की गोलियां, these are just a form to make the sukshmata and then trituration, so that will be the first one potency of the drug, 10x potency of the सुवर्ण सूतशेखर। फिर उसमें से एक कंपोनेंट लेना है, एंड जो ट्रिचुरेटेड है उसका एक कंपोनेंट, फिर नेम ऑफ द शुगर जो होम्योपैथिक के ग्लोब्यूल्स है, then once again triturate, that is the second potency. So if it is going on more potency, it will be the smallest amount of that churna is equally working like the 1 tablet of the suvarna suchakar, because suvarna suchakar nearly cost about the, for the 5 tablets only 1000 rupees, and the poor patient are not affordable for that. That's why this idea I have used, and which works very well, which works very well. This is adopted by the long term practice. It can be utilized by the other person also.
जी, बहुत बहुत
मैम,
धन्यवाद
सूक्ष्म
डॉक्टर।
चूर्ण का फिर डोज बड़ा होगा ना?
नहीं
सूक्ष्म चूर्ण का डोज
नहीं मैडम,
कितना
सूक्ष्म
डोज
चूर्ण
देते?
का डोज जो है वो हम 5 ग्राम तक दे सकते हैं, बट इट इज अ शुगर ओनली ना, उसमें क्या है वो द्रव्य आ गया है, बार बार हम जितनी मैं वही बोला ना, उसकी पोटेंसी बढ़ानी है हमें, मीन्स जितने बार मैंने उसमें से एक लिया फिर और ऐड किया, सो 10x 100x, तो जितनी पोटेंसी ज्यादा होगी उतना डोज कम हो जाएगा, बिकॉज मर्दनम गुणवर्धनम, दिस इज अवर रसशास्त्र रस का जो हमारा एक कंसेप्ट है रसशास्त्र का, दैट आई हैव यूज, कि उसको करने के बाद पेशेंट को इतना कम डोज में देना पड़ता है, और दैट 5 ग्राम what I am using that Sukshma Churna, it is equally effective to the one tablet of the Swarna Sutshekar, which is given for the means other doctors कि जो स्वर्ण सुच्छेकर की दे सकते हैं, तो एक गोली उसको 250 अराउंड पड़ती है, यहाँ पे मैं 250 में उसको बहुत सारे 5 दिन का डोज दे सकती हूँ. दिस इज जस्ट अ कॉस्ट मैनेजमेंट ऑफ द पेशेंट विद द इक्वली इफेक्टिवनेस.
जी, बहुत बहुत
Okay, thank
धन्यवाद डॉक्टर साहब. डॉक्टर साहब, एक मुग्धा जी ने पूछा है, इफेक्टिव विरेचन
हाँ जी.
द्रव्य इन हाइपरटेंशन.
उसमें जो है हम एक तो त्रिवृत यूज कर सकते हैं, अच्छा काम करता है, त्रिवृत बहुत अच्छे से काम करता है, बिकॉज दैट इज सुख विरेचन. एंड वन थिंग वी हैव टू ऑलवेज कीप इन द कार्डियक पेशेंट्स कि वी कैन नॉट गिव द मैसिव पर्गेशन टू दिस पेशेंट, बिकॉज आई टोल्ड कि इट कैन लीड टू द हृदयाभिघात, and those hypertensive patient can land up into the any type of the cardiac emergencies if they are not handled very well. So the sukha virechana dravya should be given. अगर ऐसे नहीं हैंडल करना हमें, तो सिंपल आरोग्यवर्धिनी कैन बी डन, because it has a in the kutuki, in that it is handling the stransana component vedana. So if you give 2 tablets in the kutuki morning evening, that also give the sukha virechana equally effect to the person. It will give the this lekhana karma as well as the mruda virechana to the patient. Or you can handle the gandharva hastyadi churna, that is third more good result, which will given me in the vata predominant type of the rudroga patient. So depending on what type of the patient and what type of the virechana you want, you can change the medicine. But Trivrit Avleha or the Trivrit Kashai, if you are making in your clinic only, it is manageable. But those to be very precise in the cardiac patient. हाइपरटेंशन के पेशेंट को भी आपको बहुत ही प्रॉपरली मेडिसिन देके कंसिडर करना है, अदरवाइज इट कैन कॉज द कॉम्प्लिकेशंस. So because always cardiac patients, though they are निदानार्थकर व्याधि, क्योंकि hypertension is nothing but a निदानार्थकर. Hypertension leads to the hridroga. So this निदानार्थकर component always to be taken care very. Even the gas, जिनको patient बोलते हैं ना हमेशा gas होता है patient, that is nothing but the gulma like symptoms. ऐसे पेशेंट में आपको गंधर्व हरित की चूर्ण, गंधर्व हरिवास्ती कषाय, they can be given very well and it works very well. Or udavarta like patients, that is also are the almost give the result like the ISD patient. So this patient to be managed in this way.
जी, बहुत बहुत धन्यवाद डॉक्टर साहब. डॉक्टर रुचि
अर्जुना जो है ना
जी जी डॉक्टर साहब.
Someone has asked about the role of Arjuna. Actually, Arjuna is balya. Here, हृदय के जो मसल्स है उसमें बल्य है. बट वन थिंग स्टिल रिमेम्बर, अर्जुना अगर देना है तो भी आपको हर एक केस में अर्जुन नहीं देना है. सी इट इज वेरी वेरी क्लियर, अर्जुना नॉट टू बी इन द वातिक टाइप ऑफ द हृदय, अर्जुना टू बी गिवन इन द कफज टाइप ऑफ द हृदय पेशेंट, because it increases contraction, it increases cardiac contractability. So when you need in the CCF, that type you have to use the Arjuna. But वातिक में करेंगे तो संकोच बढ़ने के chances ज्यादा है. So precision is very essential. या अगर आपको अर्जुन फिर भी देने की इच्छा है तो you have to manage it with the स्निग्ध द्रव्यास, और अर्जुन क्षीरपाक बनाओ, manage its other thing, अर्जुन क्षीरपाक बना के दे सकते हैं. बट बेटर नॉट टू गिव इन द वातिक, गिव इट cautiously in the vatik rudroga, but you can give liberally or nicely in the kapach type of the rudroga. It works very well. थैंक यू वेरी मच।
जी,
थैंक यू।
बहुत-बहुत धन्यवाद
मैम
डॉक्टर साहब।
थैंक यू
एक
फॉर
लास्ट
पेशेंस।
एक
मैम
मिनट,
एक पूछने
26
का था कि
सेकंड।
आप ये सूक्ष्म औषधि को
किमाया किमाया रुको,
एक
किमाया
मिनट सॉरी
डॉक्टर किमाया रुको, हाँ बेटा,
हाँ
है ना?
सॉरी सॉरी
हाँ, डॉक्टर छवि ने एक ऊपर प्रश्न पूछा था, सडन अटैक के टाइम पर हम
हाँ
कोई लाइफ सेविंग मेडिसिन या फूड
हाँ
आइटम एक्सेट्रा दे सकते हैं, एनी रस
हाँ
औषधि?
हाँ।
छवि
और रसौषधि प्रभाकर वटी देते हैं, प्रभाकर वटी देते हैं। और एक सूचिका भरण रस करके आता है, that is also given and it is given in a very very low dose, just like a sorbitrate देते हैं ना, वैसे देना है, but it is not available everywhere, that is the bad part of that. वो that is given in a miss सूचिका इतना कम अमाउंट में देना है and that is given sublingually, प्रभाकर वटी भी देते हैं, that also given. ऐसे द्रव्य दिए जाते हैं बट इतने इफेक्टिव एंड अवेलेबिलिटी इज वेरी लेस. सो मैंने बोला ना कि मैनी मेजरली वी कैन हैंडल सच अ केस and refer it as early as possible. But if the chronic cases are coming to you, then you can treat it very well. तो इमरजेंसी में अगर आपके पास ऐसी द्रव्य है तो आप जरूर दीजिए, बट अगर नहीं है तो बेटर है कि, और मौक्तिक भस्म भी देते हैं क्योंकि मौक्तिक की बहुत ही एक स्पेशलिटी है, या कामदुदा रस मौक्तिक युक्त वो भी देते हैं कुछ लोग, या मौक्तिक भस्म देते हैं, मौक्तिक चूर्ण देते हैं, बिकॉज इट इज अ कार्डियो प्रोटेक्टिव एंड इट इज कंसिडर्ड जैसे सीप मोती सीप में है उसी जैसे हार्ट भी जो है एक अवयव है जो एक प्रोटेक्टक एरिया में, सो समान है ना, समान उसके फंक्शन पे वो अच्छा वर्क करके मुक्ता शुक्ति ये मौक्तिक भस्म वगैरह देते, बट इट डजंट वर्क दैट मच इफेक्टिव, यू नो. सूचिका वरण रस वर्क्स वेरी वेल बट अवेलेबिलिटी इज वेरी बैड, दैट्स द प्रॉब्लम. तो ऐसे द्रव्य नहीं दे सकते हैं, कुछ मिलते हैं अगर आपके पास अवेलेबिलिटी, दैट कैन बी यूटिलाइज डेफिनेटली
जी, बहुत
एंड
बहुत धन्यवाद
दैट
डॉक्टर.
वर्क्स इक्वल टू अवेलेबिलिटी ऑफ द मेडिसिन इन एवरीवेयर इट इज क्वाइट टफ. तो बेटर है कि अगर हमारे पास लाइफ सेविंग सॉर्बिडेट लाइक द्रव्य है तो बिल्कुल देना चाहिए, नाइट्रोग्लिसरीन है तो देना चाहिए, क्योंकि अल्टीमेटली वी हैव टू टेक केयर ऑफ द पेशेंट. But if you are regularly practicing the cardiac cases, you can keep all this medicine with you. So you make the store of all the cardiac emergency medicines with you and you can handle the emergencies. But then also they need to be immediately referred to the intensive care so that they will be taken care in the all angles.
जी, डॉक्टर किमाया आप अपना प्रश्न पूछ लीजिए.
मैम ये सूक्ष्म औषधि का आपने जो बताया, सिर्फ
हाँ जी.
मेरे को एक सवाल था कि
हाँ.
इसको स्टोर करते हैं तो थोड़ा उसको खराब होने का डर रहता है, तो उसके
यस
लिए आप
मैडम,
क्या
यस.
करें?
वो जो रहते हैं ना सिलिकॉन के जेल्स मिलते हैं, देखो आपने देखा होगा सिलिकॉन के जो बाकी भी हमारे रसौषधि के पैकेट्स में मिलते रखे हुए
ओके
टू एब्सॉर्ब द मॉइस्चर, उसे हमें वो चूर्ण में वो पैकेट डाल के रखना है. इट विल एब्सॉर्ब द एंड यू हैव नॉट टू मेक द टू मच, you have to make the batch so that it can be utilized immediately. That is the because we are managing the cost, so we have to think in the many ways, है ना. वेस्ट भी नहीं करना है हमें.
और मैम जो आपने वातिक इसमें बोला ना सर मैडम, तो उसमें
हाँ जी.
एक अर्जुन और धमासा कॉम्बिनेशन है ना, एक वो अच्छा काम करता है क्योंकि एक डिश
धमासा इसलिए देते कि धमासा वर्क्स एज हाइपरटेंशन में भी काम करता है. तो जहाँ पे वात पित्त रुद्धि है ना हाइपरटेंशन, तो वो कम करने के लिए धमासा दूसरा काम है, आपको स्ट्रेस भी कम करता है, इसलिए वातिक में देते, क्योंकि जब भी स्ट्रेस होगा इमोशनल अपस्ट्रेट causes the spasm. Angiosperm is the any emotional upbeat results into the spasms. That's why Arjuna and Damasa is given together.
त्रिदोषहर है ना,
त्रिदोषहर है, बट का मेन काम क्या है पता है क्या? वो आपको स्ट्रेस बहुत कम करता है इमीडिएटली, तो दैट्स व्हाई इट वर्क्स वेल. तो उसमें से भी उसका जो बोलते हैं ना प्रभाव ऑफ द द्रव्यास, दैट वर्क्स वेरी वेल.
ओके, थैंक यू.
जी, बहुत-बहुत धन्यवाद डॉक्टर साहब। आज मुझे एक बात और भी याद आ रही थी, जब मैं वहाँ जयपुर में थी तब डॉक्टर तपन वैद्य जी ने अ, बहुत अच्छी तरीके से बहुत सारे कैंसर्स के ट्रीटमेंट बताई थी। वहाँ भी वो जो डॉक्टर साहब ने बताया वही लाइन ऑफ ट्रीटमेंट के ऊपर कि आप सिंपल सा द्रव्य, है ना? सर ने बहुत सारे औषधियों के उसमें पूछने पर ये बताया था कि नहीं, मैं तो अविपति कर देता हूँ, मेरा पेशेंट ठीक हो जाता है। मैं सितोपलादी देता हूँ। मैं ऐसे में बड़े सिंपल सिंपल जिसको हम ऐसे सोचते हैं कि अच्छा कैंसर के ट्रीटमेंट में काम कर लेंगे ये। अच्छा यूं, क्योंकि कैंसर सोच के हम बहुत बड़ी वो सोचते हैं, मगर कहीं ना कहीं तपन वैद्य सर ने बहुत अच्छा एक मार्गदर्शन किया था, जैसा उसी पाथवे पे आज आपने भी बड़े सामान्य सामान्य द्रव्य के साथ पोटेंसी बढ़ाने का एक बहुत अच्छा आपने आइडिया दिया। कि मुझे एक बापालाल वैद्य जी की द्रव्य गुण पढ़ते समय मुझे ऐसा ही कुछ वहां भी, है ना, उनका एक कुछ रेफरेंस याद आ रहा था कि गुरुजी ने भी कुछ ऐसे ही पोटेंसी बढ़ाने के लिए कुछ होम्योपैथी का तो नहीं मगर और कुछ बताया था। तो आपने बहुत अच्छा पिकअप किया डॉक्टर साहब, जो क्रिएटिव आइडिया है कि जिसको हम पोटेंसी बढ़ाने के लिए बहुत अच्छी तरीके से उपयोग कर सकते हैं। मेरे गुरुजी भी मंगलदास जी स्वामी जी, वहाँ मैं जब धन्वंतरी औषधालय में सीखने के लिए जाती थी तब गुरुजी ने भी बताया था कि 1 ग्राम स्वर्ण औषध 10 दिन में खिलानी चाहिए। मगर अगर पेशेंट के पास नहीं है इतना तो वही 1 ग्राम 1 महीने में खिला दो किसी और औषध में, इसी तरीके से अच्छी तरह से घोंट कर ऐसे। तो मैं गुरुजी को कहती थी तो गुरुजी कहते थे कि नहीं, अगर श्रद्धा रख के यही औषध वो ले लेगी, ये ले लेगा तो बहुत अच्छा रिजल्ट रहता है। यानी 1 ग्राम स्वर्ण सुतशेखर या 1 ग्राम रसराज रस या 1 ग्राम बृहद्वार चिंतामणि या 1 ग्राम वसंत कुसुमाकर, जो भी आपके मुख्य औषध के साथ, है ना, बहुत अच्छी तरीके से पहले वो 10 पिल्स गुरुजी खरल करवाते थे और फिर उसमें जो दूसरी काष्ठ औषधि वाला द्रव्य जो योग है उसको अच्छी तरह से मिला देते थे, चम्मच से नहीं, है ना, खरल से। तो खरल में थोड़ा थोड़ा ता मिलाते गए और उसको खरल करते गए। तो बहुत अच्छी तरीके से मैंने गुरुजी के पेशेंट्स में तब देखा कि बहुत अच्छा रिजल्ट्स मिलता है। और विश्व आयुर्वेद परिषद के इस प्लेटफॉर्म से डॉक्टर शुभांगी जी पाटिल, बहुत बहुत हार्दिक धन्यवाद। आपने इस ज्ञान यज्ञ में बहुत अच्छी आहुति दी, जो कहीं ना कहीं हमारा जो एक उद्देश्य है कि हमारे स्कॉलर्स, हमारे स्टूडेंट्स, नॉट अ जॉब सीकर बट जॉब प्रोवाइडर, है ना, वो जॉब कम से कम 3 लोगों को दे, ज्यादा को देते हैं। तो मुझे लगता है कि 10 वर्ष से अनवरत निशुल्क रूप से चलने वाली इस व्याख्यान माला का जो एक श्रम है वो व्यर्थ नहीं है, वो सार्थक है। तो कहीं ना कहीं अच्छे अच्छे वैद्य निर्माण हो तो बिल्कुल बहुत बढ़िया रहेगा, और आप जैसे लोगों का साथ मिलता रहे। बहुत बहुत धन्यवाद डॉक्टर साहब।
थैंक यू वेरी मच मैडम, थैंक यू वेरी मच.
जी, सबसे लास्ट में मैं शांति मंत्र ले रही हूँ, आप सभी म्यूट रखकर ही दोहराएंगे। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। नमो नमः। विश्व मंगल की कामना के साथ आइए हम सब मिलके आयुर्वेद के लिए अच्छे दिन आ जाए और भारतवर्ष की बहुत अच्छी स्वास्थ्य में सुदृढ़ता बने, इसके लिए प्रयत्न करते हैं। बहुत बहुत धन्यवाद।